Hi, my name is Dr. Lynae Brayboy. I'd like to talk to you about some of the financial issues when you're dealing with infertility. For patients struggling with infertility, the difficulty of determining the cost of treatment adds additional stress to an already frustrating situation. The cost of infertility treatment varies greatly depending on the recommendations from your doctor, and unfortunately, it can be very costly. It is important for patients who are considering treatment to identify if their health insurance provides coverage, and if so, what exclusions and/or limitations there are prior to proceeding. It is also important for patients to determine what their estimated financial responsibility will be and whether they are accessing their health insurance benefits or paying for the treatment out of pocket. In Rhode Island, Massachusetts, and Connecticut, state law mandates that insurance carriers provide coverage for treatment for patients that are diagnosed with infertility. The definition of infertility varies across the 3 states and may include criteria based on age and/or marital status depending on the state in which the employer obtains the insurance coverage. Employers that are self-insured and religious organizations can be exempt. There are certain restrictions in each state on the maximum amount of treatment coverage that must be provided. If you are planning to utilize your health insurance, you must make every effort to fully understand your coverage to prevent unexpected costs for your treatment. If at all possible, you should obtain your summary plan description, usually provided by your employer, which outlines all of the benefits which are included in your specific insurance plan. Our financial counselors are trained to help you navigate your insurance coverage. We make every attempt to ensure that you have accurate information regarding coverage. Ultimately, the contract for your coverage is between you and your insurance carrier. We always encourage you to have direct communication with your carrier regarding what treatments are covered and are not covered. When contacting the insurance carrier, you should first determine whether your insurance policy runs a calendar year or a plan year. This information will affect you specifically if you have a yearly deductible and/or an out-of-pocket maximum. A deductible is a dollar amount which must be satisfied by an individual or family before insurance coverage takes effect. Many insurance carriers require that the patient pay coinsurance for infertility treatment. This is usually a percentage of the cost of treatment. You will need to work closely with our financial counselors in order to determine exactly what your coinsurance for any given treatment will be. Coinsurances do vary from insurance carrier to carrier. If your insurance plan has an out-of-pocket maximum, then any covered services that require a coinsurance will be covered at 100% after you reach that maximum. It is important to consider that the deductible and out-of-pocket maximum when planning treatment because they can affect your decision on when to proceed with treatment in order to maximize your insurance coverage. Many insurance carriers limit the amount of infertility treatment coverage per patient. The limitation may be a dollar figure or a maximum number of treatment cycles. If the limitation is a cycle maximum, it may be a yearly maximum or a lifetime maximum. It is important to understand these limitations prior to starting treatment, as these limitations may impact a patient's decision on which treatment to proceed with and/or when to proceed. Our practice is an ambulatory division within Women and Infants Hospital, and as such, all services are considered to be performed in an outpatient facility setting. This may affect your coinsurance for services provided. When contacting your insurance carrier, be sure to inform them that the services will be provided in an outpatient facility setting. While we do not provide medications through our facility, it is still important that you are aware of your coverage for infertility medication. Most insurance carriers will require that you obtain your medications through a specialty pharmacy, so you will need to know which specialty pharmacy your insurance carrier will require you to use. If you proceed with treatment, our staff will assist you by providing you with information regarding your recommended medication and dosage so you can obtain pricing for your medication through your specialty pharmacy prior to proceeding with treatment. Many insurance carriers will require pre-authorization for treatment, so you should always speak with our financial counselor before starting any treatment cycle. If you do not have infertility coverage through your health insurance plan, then it is important for you to obtain our pricing information so that you know upfront what the cost of treatment will be. As most treatment performed at our facility is considered elective, payment for treatment must be made at the time of service. As a patient, you will be referred to our financial counselors who will work closely with you to provide information so that you can make an informed decision regarding treatment prior to proceeding. While the hospital does not offer payment plans for treatment, we do have resources available to assist patients with funding for treatment. Please be sure to speak with our financial counselor if you need any additional information. Dealing with infertility is a stressful time for any patient. Trying to understand how to cover the cost of treatment certainly does not make it any easier. As insurance plans become more complicated, it is especially important that you utilize all resources available to you in order to ensure that you have accurate information regarding the cost of treatment. Be sure to reach out to your employer's Human Resources Department and your insurance carrier to ask specific questions regarding coverage. As you proceed with treatment, our financial counselors are trained to assist you in understanding and interpreting that coverage and will be able to provide you specific information on what your expected financial responsibility will be prior to proceeding with treatment. It is our job to make this process as easy as possible, and we look forward to answering any questions you might have.